To some health matters now, the migration of doctors and other health workers in Nigeria to other countries is taking a toll on hospitals across the country as the institutions have reduced the number of their outpatients and surgeries due to a shortage of manpower. Investigations show that almost all the health institutions were battling with the shortage as they could not cope with the high number of patients who thronged the government hospitals, which were affordable compared with the private ones. The chairman of the House of Representatives Committee on Health had on Wednesday raised the alarm that not less than 5 wards with about 150 beds had been closed down at the Lagos University Teaching Hospital, Idiaraba, due to a shortage of health workers. The chairman of the committee, Dr. Amos Mogaji, said the 5 wards had to be shut because there were no workers to operate them despite the large number of patients received at the institutions daily. And at this point, joining me to make sense of this conversation, I have Dr. Chukwudi Analo, consultant primary care medicine, Sheffield, United Kingdom. Thank you so much, Dr. Analo, for talking to us at this time.
Hi, thank you very much. I'm Lekan. It's nice joining you and to talk about such a topic that is really at the heart of our development as a nation. And we can follow in from what the person you spoke to earlier on has said in terms of the significance of human life. So it's quite an interesting point to have this conversation.
Of course. Dr. Analo, let's start this way. You are in the UK. How do you feel when you see the number of Nigerians that throng the UK system, the healthcare UK system, for jobs, knowing fully well that we have a deficit in Nigeria?
Well, I must say it's a conversation that comes with a lot of pain in my heart because I, for one, when I left Nigeria, I only left with the intention of just going to study a master's to improve my skill sets and come back to the system. But the question you keep asking yourself on a daily is, where do you enter the system again and how does the system receives you back? So that's the challenge we have. So it's a conversation that is, I must say, is painful. As much as you appreciate the fact that people need to move for a lot of reasons, people want to move because of economic reasons. But the core of it, I think, is more about self-development. It's more about a system that gives you hope, a system that gives you a pathway to see your life ambitions, why you become a doctor, and a system that allows you actually feel the need that you're actually doing something, not a system that where you try to do certain things, you are limited by a lot of things. So I think it's painful to see the migration, but at the same time, it's also one that you fish that we can address immediately. It is something that requires, I would say, an emergency to be addressed. But do we actually see the emergency? Do we see this sense of urgency with the government? I would say no. So I think that is more where the pain is from, the fact that we don't see the urgency from our government to address it.
Well, definitely, we still need to look at the probable solutions to this. But then we know that when we have these medical professionals leave the country for greener pastures, as people usually say in other countries where the systems actually can accommodate them, that negatively impacts the healthcare system, most especially in Nigeria now that is in context as we speak. Now, would you blame the Nigerian government for these? Would you say that they have not actually acceded to the demands or invested more in the health system? Or you would say that they are just hamstrung and as the case says, they probably would just have to let those who want to leave?
Well, I do say, I would put it very succinct to say the government has just shown total carelessness and total disinterest in healthcare. The government has not addressed healthcare as a fundamental human right that it is for its citizens. So that is, the government is at the forefront of the blame because healthcare is one of those sectors that over time you need to invest over years to see returns. We did enjoy some improvement at some point, but I will say since 2012 thereabout, we've just seen a decline and there's been zero investment, there's zero commitment. And the most important thing is when you look on the contrary side, you see the government wasting a lot of resources, and that makes you question that what is the priorities of our government.
Oh, all right. So in your own opinion, what do you think can be done now? Because you've mentioned the issue of not investing enough or not allocating enough resources to the health sector. Of course, that would mean pumping more money But then if we were to look at other areas in terms of policies to be made, some people have said that there's a need for the government to bring up a legislation, or the arm of government, that is the legislative arm, to come up with a legislation that will in a way stop or stem the tide of medical practitioners leaving Nigeria for other countries. So do you think that in a way could reduce the number of those who would be wanting to leave Nigeria for greener pastures in the medical field elsewhere?
Well, I do say a lot of things need to be addressed, and I'll try to speak faster. So a few things need to be addressed, and then policies are the core of it. I keep saying the thing. Pumping in a lot of money into the current health system we have at the moment is a total waste. It's like pouring water into a basket. There are so many leakages that the government needs to address first with policies. So there needs to be a thorough look at policy. But when we talk about policies, we need to talk about policies that are human sensitive. So policies that are empathic, not policies of, oh, you want to tie people down to career pathways that you know that will yield nothing at the end. It needs to be an honest conversation from the government with the stakeholders in healthcare. And this is where I have a huge challenge with Nigerian healthcare system. Where is the platform for these conversations? In places like the UK, healthcare development are done from the university processes. You know that if you do a policy paper and put it out there as a publication, you are sure that somebody is going to look at it. The question in Nigeria is, where is the government getting the information and the evidence it is using to design and inform its policy? That is a huge problem, because that is the only way we can now say, are we actually seeking the right policies? What evidence, what papers, what researches, what surveys are informing the government's policy? This is something that nobody can actually understand. So I think the first thing is policies at the heart of it, not money, because money is just going to be like pouring water into a basket. We need to address policies, but the policy, the question is, are these policies going to be evidence-driven? Are these policies going to have the right stakeholders on the table, not just favoritism and nepotism, not bringing in people because of their tribe or because of who they know to come and address policies? It is about who are the experts, who are people who have shown a lot of work in designing health systems, who you can bring to the table and say, let us talk about what policies are the most favorable policies to address the current health system. At the core of it, one I think I will always mention is the fact that we need to decentralize our healthcare system. The idea of the federal government getting involved in healthcare system, not as a regulator, but as a delivery provider, it's something that I find very appalling. Can the government simply, the federal government needs to move more into regulation and allow more of the state government and the private sector with the local government to go more into that. That way we can be able to say what?
Okay.
States that have more capacity can start driving forward,
All
while
right.
states that have less capacity can catch up. This
Okay.
is the
All right, Dr. Chukwudi Analo, thank you so much for your insightful contribution on the news.
Okay, thank you very much, Lekan.